We owe the ancient Egyptians so much. Even if you were to make a quick list of the things that they achieved, you would find things like measurement mathematics. That's the invention of a unit of distance to measure things. The measurement of time, dividing the day into 24 hours and the year into 365 days. The written language with their hieroglyphics on papyrus, which they also used for the first time. This allowed us to keep records and saw the birth of powerful administration. It's not surprising then to know that they also fostered some very important physicians, and that includes some of the world's first neurosurgeons. When we think of ancient Egypt, many of us will automatically think of mummies. Mummification was an important process in honouring the dead. They saw it as an essential step to ensure a good transition into the afterlife. It was important to preserve the body so that when the spirit returned, it found its body untouched. A key process in facilitating this was the extraction of the brain from the skull without changing the appearance of the face. To do this, ancient Egyptians developed several techniques to remove the brain through the nose. One method used saw the embalmer inject liquid into the skull and then drain it out through a hole in the base of the skull. This hole would then allow the fluid to run out of the nose. Another method that's thought to have been used is the use of a metal hook. The embalmer would go up the nose with a rod and break the base of the skull, at which point the hook would be used to pull out the brain through the nostrils. Whilst this may sound super gruesome, this is in fact the same pathway we use nowadays in what we call transsphenoidal surgery. In such operations, neurosurgeons use a small camera or an endoscope to delicately access the base of the skull to remove pituitary tumours. We owe a lot of this knowledge of the anatomy to the ancient Egyptians. In 1862, the world came to know of the Smith papyrus. It's the oldest known surgical treatise, dating back to around 1700 BC during the Second Intermediate Period. It's particularly important because it shows a rational approach to medicine as opposed to treating patients with magic. Its contents are largely attributed to Imhotep, an ancient architect, priest, and physician who lived a further 2,000 years before this paper was written. In this paper, the author describes a variety of cases, such as a skull base fracture leading to bleeding behind the ears. This is a well-known neurosurgical sign, nowadays called Battle's sign. They also described hemiplegia, the inability to move one's limbs in a patient with a complex skull fracture. The author noted that the patient was unable to move their limbs on the side opposite to where the fracture had occurred. This also is a key concept in modern medicine called localizing features. It allows us to predict where in the brain a patient might have sustained an injury based on the knowledge that brain cells or neurons cross over in the spinal cord to the opposite side of the body that they came from. In medicine, we love long words, and this crossing over is called decussation. The author also found that in crush injuries, where a patient's spine had been compressed, the patient lost both sensation and movement below the level of the injury. He also recommended to keep the spine very still and stable after the injury, a concept that is fundamental nowadays to our management of trauma. But this isn't the only record we have of such things. Another fascinating example is that of the Ebers papyrus, from about 1550 BC. This is perhaps the best record we have of Egyptian medicine in general. Although many of the ancient Egyptian approaches to medicine focused around banishing evil spirits, we can still see clear evidence of early empiricism in their practices. That is, that they reached their conclusions through material evidence at their disposal. This is an astonishing achievement in the timescale of history, one which, like many things from ancient Egypt, is way ahead of its time. Finally, you'll all have heard of Tutankhamun. Well, as it happens, the pharaoh himself would have been no stranger to one of the most curious neurosurgical presentations, Hydrocephalus. Hydrocephalus comes from the Latin for water on the brain, describing an appearance of a large, supposedly water-filled head. Nowadays, we know that this isn't the case, and it's usually due to increased pressure in the skull, which can push outwards and stretch the skull in extreme cases. Well, it's rumoured that Akhenaten, the previous pharaoh and father to Tutankhamun, is quite unusually portrayed in ancient Egyptian art. Whereas pharaohs were usually portrayed as tall, athletic figures of great beauty, King Akhenaten was painted as having a sagging stomach, large breasts, a strange face, and a very long, big skull. This has caused a lot of debate over the years, with many people suggesting that he had some degree of hydrocephalus. However, many have chipped in with their own diagnoses, which include Froelich syndrome or Marfan syndrome, which you may want to have a read about if you're interested. Here at Brainbook, we'd like to chip into this debate with another differential diagnosis, Craniosynostosis. This is a condition which sees the skull fuse abnormally and which can lead to patients having much longer skulls. Who knows? Maybe one day we'll unearth a papyrus and discover the truth. For now, it's just one of many neurosurgical marvels that ancient Egyptians had to offer. This has been a whistle-stop tour through ancient Egypt and neurosurgery. It's fascinating to see how advanced their civilization was so many years ago. We hope this has sparked your interest in medical history and encourage you to read more on the topic and to dive deeper into the murky records that we have on the time and get lost in your imagination of how things might have actually been over 4,000 years ago. Make sure to check out our other videos on the history of neurosurgery and keep an eye out for more coming up.